As we opened the school year, it was truly what I call the perfect storm.
Doctors say that storm is flooding Bay Area hospitals with pediatric COVID-19 cases.
I think there is evidence, at least in the past 2 weeks, that children are making up a much higher proportion of all cases that are emerging in Florida.
During a virtual roundtable with Congresswoman Castor, USF Dr. Jason Salemi, who studies COVID in the community, began with some new data. He says COVID cases are spiking in the 2 youngest age groups, even as new cases have decreased among all adult age groups over the last 2 weeks. Positive cases are up 45% in 12 to 19-year-olds during the last 14 days, and they're up nearly 60% for the 12 and under age group, which can't be vaccinated yet.
But this is very different than anything we had last year.
Doctors say the vast majority of those children make a full recovery, but physicians with Bay Care Health say it's putting a strain on the hospital system.
When you're going from a handful a week or a handful a day to having several hundred within a whole month, that's a lot of patients that are going through this experience.
During the roundtable, community members asked when the COVID-19 vaccine would be available for children under 12. These physicians didn't venture a guess, but said the approval process is going as fast and as safely as possible.
So it's always in science operating out of an abundance of caution and making sure that before we put needles in arms, especially of children.
Meanwhile, Salemi says there is some encouraging data. Teenagers are now getting vaccinated at a higher rate than adults in their 20s. And Governor DeSantis says monoclonal antibody treatments are proving to be as effective as he'd anticipated.
You have the tools to prevent and you have the tools to treat, but don't think that somehow this is something that you're never going to come in contact with.
And this puts an even greater focus on very young kids. One of the biggest concerns among doctors remains the unknown long-term effects of COVID on children, both medically and mentally.
The real tragedy here is that we're seeing extreme behavioral health issues as a result of isolation from the early starts of the pandemic.
And doctors say along with that isolation, children are also dealing with decreased socialization and depression, and those who have had to deal with a loss during the COVID-19 pandemic, Chris.
A lot of ripple effects that kids are having to go through because of this. All right, thank you. Aaron Mesmer live for us.